gonna share my screen. All right, hold on, guys. All right, we are on 13, right? The ear, do I have it right?
We are in 12, I think.
The eye.
Chapter 12.
12?
Yeah.
Oh, I thought we were on 13. Silly me. All right, hold on. Ah, cancel. Okay, hold on. Ah, we're on the eye today. Is that correct?
Yes.
Yeah.
Okay. I don't know what I was looking at. I must have been 1 week ahead. Okay, can you guys see my screen?
No.
No? Okay.
No.
Sometimes this works so flawlessly, and sometimes it is a pain in the butt. All right, now can you see it?
Yeah.
Yes.
Yes.
You can see that eyeball? Okay.
Yes.
Okay. So this is actually a healthy, nice, healthy eyeball with all the veins and the blood vessels and the arteries going through it. So, of course, they always start out with the anatomy of the eye. I'm not real worried about all these different parts. I do think it's very cool how the eye works. And I think it's really neat that the only thing that really is attached to the eye is the optic nerve and the arteries that come through the back of it. But the eyeball is a pretty complex piece of equipment in our body for being so small. Okay, so the visible surface of the eye is mostly what people associate as the eye. Okay, so the lacrimal caruncle, okay, is in the corner. We have one each on each side of our nose at the corner of our eyes. That is where the tears come out of, believe it or not. When we cry, that is where they come out of, and that is where things can actually get in to the and go down through the nose too. You can feel that way too. The pupil is actually, it is nothing. It's kind of like an open space, but it's a very important part of our eye because it can tell us what's going on in our brain. It can tell us if we're hemorrhaging, things like that. When it's exposed to light, it gets, let me get this right. When it's exposed to light, it gets small, and when there is no light, it gets big because it's letting more in. The iris is the part that gives us the color of our eye, and the conjunctiva is the white part of our eye. Okay. So the lacrimal apparatus, or the tear apparatus, okay, we have ducts all over and glands all around the eye, okay, but the lacrimal duct and canal actually go down into the back of our sinus, okay, which is pretty cool. That's why one thing people will say when they're crying, and they'll say they can taste their tears. You feel that, you get that salty taste in your mouth. It's because they are actually coming down through the duct. Most of the time, our eye is tearing, okay, and we don't know it's tearing. It's cleaning the front of the eye, because the tears just go straight down that duct and we don't know it. But when we cry and we're secreting extra water, that's when it spills over into our face because we clog our ducts with too many tears. Okay, so here are some terms. The watery liquid found in the anterior cavity of the eye is the aqueous humor. Okay, the optic nerve, it carries impulses from the retina to the brain. The lens's function is to focus and bend light. The cornea, okay, allows the light rays to enter the eye. And the sclera is the white of the eye. The sclera does not have a big job other than what I say to protect the inside of the eyeball and to indicate when things are wrong. We can really tell a lot about when something is wrong with the liver, because the sclera will get very yellow. We can tell if there's an infection in the eye because the sclera will get, often it'll get very red, or it'll get, I don't want to say pussy, but it'll kind of get a glaze on it. So the sclera doesn't have a lot of functions, but it can tell us a lot about what's going on inside a person too. All right, so two, binary, the prefix is two, okay? So these are some important ones for the eye. Opia means the condition of seeing or vision, okay? Phobia, we've talked about this one in previous chapter, the abnormal fear or aversion to specific thing. In this chapter, photophobia is a big diagnosis word. And it doesn't mean you're afraid of the light, it means you're sensitive or you have an aversion to the light, okay? And plegia, it means paralysis. In the eyes, they often, when you have an eye exam, one of the things that they will do is paralyze the eye so they can bring the tools and the equipment in closer. So they'll add paralysis drops to your eyes, and basically it's just numbing medicine. Okay, so the spelling of ophthalm, okay, sometimes I really push the spelling, but it's important. The ragia or ragia, the RRH words we talked about a couple chapters ago. Ophthalm is very important too, okay? They are one of the most misspelled words, okay? So medical terms containing ophthalm, okay, are often misspelled by omitting the first H, because a lot of times we'll say ophthalmology. It's really ophthalmology, but it doesn't really matter. So remember, there's a PH and a TH. So you have to rhyme when you spell it. You always say OPHTH. If you remember the rhyme, you'll be okay, okay? Think pronunciation when spelling the term. If you say it really, really carefully, it's ophthalmology. But when we say it fast, it comes out as ophthalmology. Okay. So again, the rhyme, OPHTH. Okay. So let's read this word backwards. Okay. A condition of fungus in the eye. Okay, so oculomycosis is a fungal infection in the eye, and fungal infections of the eye are very common, very, very common. Okay, again, we talked about an abnormal fear or aversion or sensitivity to the light. That would be photophobia. Ptosis is drooping, and blepher means the eyelid. Okay, so blepharoptosis is drooping of the eyelid. Okay, and you can see in this picture of this little girl, she can't keep her eyelid open. Okay, there's a muscular reason that her eyelid is not staying open. This poor little guy, okay, if I read this word backwards, he has inflammation of the tear, of the cyst that makes his tear. So he has a dacrocystitis, okay? So his tear duct is completely inflamed, okay? It's clogged. We see this a lot with kids because kids don't keep their fingers out of their eyes, okay? If they have an itch, they scratch it, and you know, their fingers are little, their fingers can get into their lacrimal ducts very easily. This probably would be something they would give them antibiotics for. Okay. So this is blepharitis, okay? Bleph means the eyelid, okay? And this is really, really a gross eyelid. As you can see, it's got a lot of oil and buildup of things on it, okay? And so there's inflammation on the eyelid, okay? And B is the second. Almost all the eye things, anytime you hear an F sound will be a PH, which is an easy way to remember how to spell them. Okay, so the first, this is to show us cataracts, which is just a medical term for clouding of the eye, okay? The top one has just a real small cataract in the middle of it, okay? Whereas the bottom one, almost the whole eye is encompassed by a cataract. And you can also see on the bottom one, there are some tiny dots of, it looks like broken down cells. Okay, that looks like some old red cells that are in there. So cataracts can be little and only take up part of the eye, or they can take up the whole lens. Okay, and so when someone gets cataracts, we try to get them while they're small. Okay, they try to get them while they're small. Okay. An infection of the oil gland of the eyelid is a stye, okay? And they are usually, the difference in eye infections, if you get a cyst or the gland is usually in the on the corner, that's the duct, okay? But an oil gland will usually be on the bottom or on the top, but it will not be in the corner, okay? All right, so these are our, how they diagnose our eye vision, okay? And hold on one second. I wanna kind of go here with this, okay? So myopia is nearsightedness, okay? Nearsightedness means you can't see far away, okay? Farsightedness means you can't see up close very clearly, okay? And blurry vision, okay, means it's an astigmatism. So it all depends. It's kind of like an inverse relationship. When we say someone is nearsightedness or has myopia, that means they can't see far, okay? When we say they're farsighted or they have hyperopia, that means we can't see near, okay? So an astigmatism has nothing to do with being nearsighted or farsighted. It just means that there's an irregular curvature of the cornea or the lens, okay? So if we're looking, this is basically how we're looking at the eye from the side, okay? So this is a lateral view, as if the eyeball is facing towards the left and it's attached to the brain on the right, okay? So the retina, or this whole area that goes around in the yellow, it should always be attached to the choroid, the choroid, or the outside of the eyeball. When a retina detaches, okay, it pulls away from the choroid, and it can also have a tear in it. So when there's retinal detachment, it means it's pulled away from the choroid, but it can also have a tear in it. And that is something that requires, if there's a detached retina, it usually requires some surgical rectification. Okay, this is actually a pretty interesting slide. If you look at the picture, you will see, okay, the cornea has been replaced. So you will see all these tiny little stitches that are holding it in place. Can you see them? It looks kind of creepy at first when you look at it. Okay, and yes, the entire eye is very injured and very angry. Okay, but what they've done is replace this person's cornea. Okay, and it's called a keratoplasty. But it is pretty interesting when you think that each one of these is an individual dissolvable stitch. Okay.
Why would they have to replace a cornea?
Oh, for lots of different, sometimes they wear out. Sometimes they get damaged in an accident. Um, Sometimes they become diseased. Um, Probably the biggest reason is because people get poked in the eye. Believe it or not. You know, you don't poke, don't play with those sticks. Somebody's going to get poked in the eye. That's one of the reasons. Believe it or not. Okay, it can get infected and sometimes be severely damaged. But this slide just, it blows my mind how they can do such straight stitches on such a tiny area. Now, obviously, they're doing it under a microscope. Okay, but it's kind of creepy. I love Lindsay's face. She's just like, ew, that's almost disgusting. Okay, but it is. It's pretty cool that they can actually replace the cornea. Sometimes the cornea, it can be, it can, you know, something can fly in your eye and you can have such a bad abrasion that the infection, people let in eye infections go. And sometimes it becomes to the point where they have to get it completely fixed. So. All right, so this is LASIK, okay? And you can see they're basically taking the cornea off, okay, fixing it and reattaching it. Sometimes they will put an artificial cornea on using LASIK. I do not know a lot about LASIK. All I know is it's pretty cool, okay? They literally detach the cornea, fix it, and then put it back on. Sometimes people get an artificial cornea. Okay. All right, so we've got lots of diagnostic terms built from word parts in this, okay? Anything, you know, we know meter means they're measuring pressure. So a keratometer is measuring eye pressure, okay? A pupillometer is measuring the pressure that the pupil has, okay? A tonometer is measuring, oh gosh, I'm blanking. I'm gonna come back on that. I'm sorry. Retinoscopy, they can actually look in through the pupil and look at the retina, okay? One of the things they will put in your eye is fluorescein dye. It's kind of like an orangey yellow dye, and when they do that, it just makes a lot of the inside of the eye. They can then use a UV light, and they can really see a lot more of the inside of the eye than they could just by looking in through the pupil. Okay. Whoops. So an ophthalmologist is the physician who studies and treats diseases of the eyes. That's different than the optometrist. The optometrist is a person who works on the vision with glasses, okay? But an ophthalmologist is one you would go to study diseases of the eye, treats the eyes. The ophthalmologist usually do the surgery on the eye. The optometrist doesn't do any surgery, okay? Oops, here we go. So an ophthalmologist is the eye surgeon. The optometrist is the health professional who diagnoses, treats, and manages diseases and disorders of the eye and the visual processing system. So they are a doctor also, but the ophthalmologist is the surgeon, okay? And an optician is the specialist who fills the prescriptions for lenses. So the optician isn't a doctor, okay? But they fill the prescription for the lenses. They're kind of like the pharmacist for the eye, okay? So if someone has age-related macular degeneration, whoops, let me go back, okay? This is what they see when they look out, okay? They see a black spot in the middle of their visual field, okay? Because the macula, okay, is deteriorating and it affects their central vision. So if you watch carefully, people with macular degeneration will turn their head and look out of the sides of their eyes because when they look straight ahead, they can't see what's in front of them, okay? This becomes a problem when they're driving, okay? There's a big kind of ethical dilemma when physicians diagnose a person with age-related macular degeneration. They really encourage them to give their license up, okay? Especially if it's at this point. Usually this circle starts out as a gray circle, so they can usually see through it at the beginning, but as it gets darker and bigger, they obviously shouldn't be driving. So this is one of the things that ophthalmologists will report to the state, and they will have their driver's license taken away. So the abbreviation for blurred vision caused by irregular curvature, okay, this is an astigmatism or AST, okay? All right, so now we're gonna go, today I wanna go through this with you just so we can get used to some of the terms. So, an elderly gentleman visited his ophthalmologist, okay? So did he see the eye doctor? Is an ophthalmologist a doctor?
Yes, I see.
Yes, yes. And the ophthalmologist is different than the optometrist, okay? So, tonometry examination showed borderline vision or borderline readings. Visual acuity measurements indicated a mild degree of myopia and presbyopia. A diagnosis of glaucoma is suspected in this case, and timolol eye drops were prescribed, 1 drop daily. A cataract of the right eye was found. Lens implant surgery, which places an intraocular lens, will be performed. So when someone has cataract, they take that out and they put a new lens in, okay? Approximately 5 years ago, the patient had a detached retina, okay, and a scleral buckling procedure was performed and was successful in halting the progression of retinal detachment. So a scleral buckling is basically like they staple the retina back to the cornea. They get in there with this tiny little thing and they staple the detached retina back on. Now you'll notice it didn't say it was torn, okay, so they didn't have to surgically repair that. They only had a detached retina, okay? All right, so let's go to the first question. True or false? The ophthalmologist used an instrument to measure the pressure within the patient's eye. All right, I'm going to go back. So yes, he used a tonometer. A tonometer measures pressure, and the examination revealed borderline readings. Okay. You don't want a lot of intraocular pressure in the eye. That causes visual problems, okay? So visual acuity measurement indicated. Okay, now let's go back. Okay, so his visual acuity, the acuity measurement indicated a mild degree of myopia or nearsightedness and presbyopia. Okay, so he had nearsightedness and impaired vision as a result of aging. So that's B. Timolol eye drops were prescribed to address symptoms most likely caused by, now let's go back. So timolol was prescribed, okay, for the diagnosis of glaucoma, okay? And glaucoma is clouding of the eye lens, okay? And then the last question is a scleral buckling procedure was used to correct clouding of the lens in the right eye. What did they use the scleral buckling for?
For retinal detachment.
The detachment, right, good. So this is false. Excellent, excellent. All right, my ladies, you guys have all been wonderful. This was a relatively short lecture. Next week's is not too terribly long either. It's on the ear. So do you have any questions about the eye? It's pretty fascinating for being such a tiny thing when you think about it. So.
Teacher.
I was dissected an eye last semester, and then also in high school, and it was like that's my favorite thing to dissect.
Oh,
Like,
yeah.
it's so cool.
And they're a lot firmer than people think they are.
Yeah,
Like, it takes a lot to cut through an eyeball.
yeah.
It really does. So,
Most of it's like fluid, so.
yep, yep.
I was there. If someone has a blepharoptosis, can they get a chiroplasty done?
Can you up your volume a little bit? I can't hear you.
Okay, can you hear me now?
Yes.
Okay, somebody has like a blepharoptosis, can they get a chiroplasty?
I don't know. I don't know enough about the eye and the different surgical procedures that they do for the eye. My mom had blepharitis, where the area where her eyelids and her eyelashes just kept getting clogged and clogged and clogged. And they did some procedures to try to unclog them, but I'm not exactly sure. And my knowledge of eye procedures is not up to snuff as it is in other parts of the body. So I'm sorry, Miss Ba.
Okay.
Anybody else? All right, my ladies. Well, everybody have a good week. Let's hope when we meet again, we're all still healthy. Okay?
Okay.
All right. Behave yourselves and have a good week.
Okay, thank
Thank
you.
you.
Bye.